Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. James Maskell is the host of a popular podcast and flagship show, The Functional Forum, the world's largest integrative medicine community, the founder of New Health, which is what I want to really talk about today. It's a payer solution for chronic disease reversal, and he's the author of The Evolution of Medicine, primarily for doctors, I believe. He is on a mission to create structures necessary to evolve humanity beyond chronic disease. He lectures internationally and has been featured on TEDx, TEDMED and HuffPostLive. James, welcome to the show.
Thanks so much. Great to be here. Really appreciate the opportunity to come in and speak to your community.
Yeah, look, I'm super excited to have you. And it's funny how I finally tracked you down, but I heard you speak very briefly at it was actually at a talk, a dinner before Paleo FX, and you came on stage and you mentioned something about, and I only sort of caught a glimpse of it. It was like New Health, and I was in the middle of a conversation at dinner and I started hearing you talk and I was like, is this a dream? I woke up the next day and I almost didn't know whether I dreamt it or whether this thing exists. And it sounds like it does exist. I've done a bit of research, but I'm absolutely fascinated to find out more. But before we do, James, can you tell us, how did you get into health and fitness and what's your background? And then how did you become so passionate about transforming healthcare?
Yeah, so I was sort of forced upon me in a certain way, in that I grew up sort of in a community where integrative medicine was just the way that it was. I had a chiropractor and a homeopath, and that was just the way that my family did healthcare. And I just didn't realize that it was abnormal until I went to school and realized no one knew what a chiropractor was. I was the only kid in school where the nurses had to call my mum before they would give antibiotics. So somehow my mum was able to sort of predict the future downside of overuse of antibiotics with no medical training by 30 years. And that always just stuck with me. And I went through my life and I sort of had a rebellious phase where I just went down a sort of a normal career path. And then 13 years ago in 2005, I had a couple of sort of moments of clarity and realized that I was playing for the wrong team. And, just something about my childhood and upbringing that I had always sort of been a bit embarrassed about was possibly like the solution to what is possibly the world's most vexing problem, which is chronic disease. Doesn't matter where you live in the world, this is something that no medical system has really got on top of, and is probably going to bankrupt every medical system, no matter whether you have like a sort of a capitalist kind of system like America with a lot of private enterprise, or whether you have a system like where I grew up in the UK, in like the NHS, or any sort of combination of the both of them, where every country is sort of suffering under the weight of chronic illness. And I've been on a sort of a 13-year mission to try and work out what's going on and what would be the structures that could be put in place to facilitate a different kind of a future. So it's been an interesting journey so far. I'm 13 years into it in terms of like my day job, but it's sort of been with me through my whole life.
So, James, when you say it's a big issue, can you give us some numbers or some stats around how big an issue it is?
Yeah, so the World Economic Forum says chronic disease is one of the biggest problems facing. They reckon that it's going to cost $47 trillion over the next 20 years. In America, 86% of healthcare costs come from lifestyle-driven chronic disease, 86%. So I think when most people think about healthcare costs, they think about ambulances and broken arms and broken legs and cancer treatment and that kind of thing. The vast majority is really treating diseases that are born of lifestyle. And so ultimately it needs, a sort of a different kind of a fix than drug therapy, because using drug therapy for lifestyle-driven chronic illness is a plan that has been done for the last 40 years that you can't really look at and say this has been a great success. It's actually been sort of like a pretty significant failure, to a point where, we just have the first time in America the last 2 years where life expectancy has gone down, right? Where you have, and that's the first time in human history. So we have a pretty big issue. If you start projecting out numbers into the future, you see that by 2040, you'll see a ridiculous percentage of GDP being made up by medical care in America and all the way around. So whatever statistic you look to see, you think that this is not going well, and we need a fundamental transformation of the health system in order to create a system that keeps people well and keeps them free of the medical system. And there are some great examples of that around the world, and what we have to do is learn from those examples and try and build systems that replicate them.
So what are some of those examples?
The blue zones, is one. I don't know if you've ever had anyone speak about that on the podcast, but there's a great book called Blue Zones, The Blue Zone Diet by Dan Buettner, and essentially he's a journalist that essentially went around looking at societies around the world where people live to 100 consistently without as much incidence of chronic disease, much lower incidence of chronic disease. There's one in just outside LA, Loma Linda. There's Costa Rica and Greece and Italy and Okinawa in Japan. And they have a number of things in common. One of the things they don't have in common is an incredible medical system, right? People stay healthy because of culture and community, and not really because of the medical system itself. So those are some of the concepts. There are things to do with diet, there are things to do, but mainly culture and community are the two things that they have in common. As an example, I lived in LA. I'll tell you that LA is not a very healthy place generally, whether it be fires or smog or, food. But the Seventh-day Adventists in Loma Linda, they eat a very clean diet, they exercise, they pray together, they have a strong community, and there are just a disproportionate number of centenarians in that community.
Yeah, look, we haven't had anyone talk about that, but yeah, I am very familiar with those zones, and it's very interesting, isn't it, that community comes into it. So then how does New Health, I guess firstly, what is New Health and how does it approach healthcare? Yeah,
so ultimately, we have been on a 13-year journey to sort of work out what are the structures that need to be in place in order to deal with chronic disease more effectively. And, what we've learned over the last 13 years is that there's two major things that need to be in place to do things differently. There's the sort of culture, community aspect that I just mentioned with regard to the blue zones. And then you need an operating system of medicine that is more designed around lifestyle-driven chronic disease. Like the medical system that we have now is really built around, was designed around acute traumatic diseases like infections and trauma. And when I say built around it, let me just give you an example. So in medicine, why is the first person you see the doctor? Why is that the thing? It's because if you have an infection or trauma, you want to see a trained medical professional who's trained to deal with that thing as quickly as possible. And you want that person to be the best diagnostician so that they can get you the right treatment. Now, if you've had type 2 diabetes for 10 years, and you're on metformin, you're not going to die tomorrow. You're not probably even going to die in the next 10 years. But, you have a chronic illness. It's costing a lot. You probably will get some other chronic illnesses over time because of the dysfunction. And so, is it so important to see a doctor straight away? Or might it be a better idea to see a health coach who could help you with eating differently or exercising or otherwise to be able to get to the root cause of what's causing, the issue there? So, you have a reactive system. We need a proactive system. We have a medication-based system. We need a lifestyle-driven system. So, we have the reason why I called my doctor-facing business the evolution of medicine, because medicine is having to adapt and evolve to a new type of disease, which is this, chronic lifestyle-driven disease, and has not really done that good a job of adapting and evolving. And so we started with the doctors because we realized that there is a medical operating system that is designed for lifestyle-driven chronic disease, that gets to the cause, that treats the body as a sort of an integrated system, and then also engages the patient to participate in their care, to participate as being an active participant, and that's called functional medicine. And it's just starting to gain popularity. And so I created a show called the Functional Forum, and the first part of our plan was all about sort of growing the army of doctors that would practice in this way. And so we spent the last sort of really 5, but more like 10 years learning about that and then building that army. And New Health is really the first time that we are creating something that your listeners could engage with if they're just, regular people and not physicians or health coaches or otherwise. And New Health is essentially a way of creating. New Health is the first medical cost sharing program that is built on. It is a medical cost sharing program that is built around keeping people out of the medical system, keeping people well, and reducing the costs associated with healthcare. So the first step, stage 1, was get the doctors ready. And now stage 2 is create an alternative to health insurance that people could sign up for, where it's cheaper and it's more aligned with, people who are health conscious.
So James, you kept saying cost sharing. How does that differ between sort of insurance versus cost sharing?
So let me give you an example, and I just have to start by saying I don't know where your listeners are mainly from, but this is such an American concept. As we get into it, you'll see that insurance and cost sharing have some similarities, right? So the structure is quite similar in that you pay in a certain amount every month, right? In insurance, we call that a premium. In cost sharing, we call that a monthly share amount. And then there's a certain amount that you have to pay out of pocket before the insurance or the cost sharing kicks in. In insurance, we call that a deductible. In health cost sharing, we call that an unshared amount. But then the plan starts to differ. And the reason why the plan starts to differ is because of the craziness of the American medical system. I mean, if you've had to endure it at all, if you live here and you've had to integrate with it, you see that there's a number of things that are really loopy about it. The pricing, as an example, no one really knows what anything costs. The doctors don't know what things cost. There's no transparency. You sometimes see a bill, but you're not sure what insurance is going to cover. That there's a lot of things that are sort of somewhat problematic when it comes to that. But let me give you an example between cost sharing and insurance to give your listeners an idea of the difference. So let's just say you break your arm. So if you break your arm and you have health insurance, your life goes something like this. You break your arm and now you go to a medical facility. You have your insurance card. Let's just say you have a deductible of $3,000. This is your first thing that's happened to you this year that you're going to use it. So you break your arm. You show up at the hospital, you give your insurance card. Now, first, you better hope that you went to the right hospital and that the hospital you went to or the facility that you went to is in network, because if it's out of network, you have problems at that point. So let's just say you go to the right place, it's in network. You have a $3,000 deductible. You give them your card. You don't really have to pay anything at the time, but ultimately you're going to get a bill for $3,000, which is the first $3,000 that you have to pay of the treatment. And then, the insurance pays everything else. So let's say, the place that you do it, which includes, taking care of your arm plus all the rehab and everything else that needed. Let's just say the whole thing is $100,000. I know that's a big number, but it's not out of the realms of possibility in today's medical system. In fact, it can be normal, but let's just say it's $100,000. So, in that case, the doctor pays, the patient pays $3,000, they pay their deductible, and the insurance pays $97,000 or whatever the hospital and the insurance company negotiate at the end of that. But they could get billed for $100,000 and then they work it out. So that's insurance. In medical cost sharing, it goes more like this. You show up at the place. You can go to any facility because there's no network. Everywhere's in network and everywhere's out of network simultaneously. There's no network and everything's a network because there is, you can pay at any medical facility. You can pay cash, right? You can say, I don't have insurance. I'm going to pay cash for my services. And what that gets you into is now you're in a position where you can get a ridiculous discount because, on the provider side, if you're the hospital or if you're the clinic, getting paid cash is great compared to having to battle with an insurance company for months to get the money. So let's just say, either you can negotiate it, or in New Health's case, you can have one of our team. You could call up and say, hey, I just broke my arm. First of all, our team would say which place to go to, which is the best hospital, which provides the best value for money, which has the best transparent pricing. So you'd show up there and let's say you negotiate and they say, okay, it's going to be $7,000. Again, those numbers, 100,000 to 7,000, is not out of the realms of possibility. This is happening all day, every day in America. So now you pay 7,000. So you either pay the 7,000 on a credit card, or you get into a payment plan with them where you pay, I don't know, $350 a month for 20 months or whatever your payment plan is. And then you submit that bill to the cost sharing community. Let's say in the cost sharing community, you could have an unshared amount of anywhere from $500 to $5,000, but let's say it's $500. You submit it and you would get a check for $6,500. That's $7,000 minus the $500, and then you would just pay yourself back. So the difference is, in one, you have insurance and the costs that get created in the background, you have no control over, and it's all very opaque and no one knows what anything costs, but the bills are always astronomically high. In the cash market, you always get the best price, and that you can see the difference between the two. Why is cost sharing so much cheaper than insurance? No one ever pays the $100,000. Right? No, there's no bill for $100,000 ever being paid by anyone. The whole cost is $7,000, which is, obviously a much more accurate reflection of what the stuff actually costs. The reason why health cost sharing is taken off in America, and when I say taken off, 1 million Americans today use medical cost sharing. Up until January, or up until basically now, the only people who could use health cost sharing instead of insurance were 5 Christian groups that were given an exemption to the ACA mandate. There was on January 1st, 2019 is the end of the individual mandate, which was something that was part of the ACA, the Affordable Care Act, where everyone was forced to get health insurance under a tax penalty. Right. So if you didn't have health insurance, then you would have to pay a tax penalty. So that's been going for the last 8 or 9 years. And 1 million Americans moved to these medical cost sharing programs because the savings are so significant. So for myself, I lived in New York in 2013. I had a child for the first time, and so I need to get health insurance. And at that time, health insurance was, I think, $1,600 a month for the worst plan for myself and my family. And medical cost sharing was $449 a month. So I signed up for one of those things. I was saving $1,100 per month, $13,000 a year that I could then use on the services that I value for health. So I like going to the chiropractor. I like eating organic food. I have a gym membership. All of these things are things that I'm spending on my health. And you can see, if I'm saving $1,100 a month, I have a lot more disposable income that I can be using on those kind of things. So it was a good fit for me. So essentially, when that law changed in January, and the sort of exemption that these Christian ministries had that had helped them to grow, I just felt like the cost sharing idea is something that should be done by a lot more people, and not just the idea of cost sharing should be less of a niche Christian thing and should be more of a natural extension of the sharing economy. And so, we just launched New Health as the first non-denominational medical cost sharing program. And, ultimately, we've added to the basic idea, which is, to having a service that will take care of you, provide a safety net in terms of a serious medical need. We've layered in some culture and community and health coaching as 3 really affordable ways to keep people well. And so we're trying to balance two and create a sort of an effective plan that keeps people out of the medical system, keeps people well, gets them off drugs, And over time, in the next couple of years, we're going to sort of really connect this medical cost sharing program with the network of functional medicine doctors that we've been building. And, by the end of the presidency, have something that is way cheaper and way better than commercial health insurance.
Well, so James, it sounds like New Health then, with the cost sharing sort of model, actually enables people to go and see doctors or I guess so more functional doctors and health coaches that I'm assuming a lot of the other insurance just doesn't cover.
Yeah, exactly. We can get into it, whatever you like, but yeah, ultimately 80% of functional medicine doctors don't take insurance, right? Once you start practicing functional medicine, you realize that being in the insurance system doesn't work out. Like if you want to spend an hour with someone and really get to the root cause of what's going on, there's no ICD-10 code for that. You have to get into a structure. And also doctors, and this is something that not a lot of people know, but if the doctor works for the hospital or works for the insurance company, if they're taking insurance, and they don't necessarily have your best interests at heart. And that's kind of a tough pill to swallow. But more and more Americans are realizing that, like, there are hospital quotas and there are pharma incentives and, there are insurance structures that incentivize the doctor to work in the interest of the hospital or the interest of the insurance company or the interest of the pharmaceutical company and not necessarily the patient interest. And one of the things about functional medicine or direct primary care or structures where you pay the doctor directly in cash, the doctor just then works for you. And we built this system based around just my understanding of the industry for the last 13 years. Our chief medical officer, Dr. Jeffrey Glad at New Health, who's the sort of hero of my book and been a friend for 13 years, he's really a guy who has showcased how to build a functional medicine practice for the middle of America. He lives in Fort Wayne, Indiana, right? He's not in New York. He's not in LA. And, his structure was pay me cash and I'll help you navigate the crazy system. So in his practice, you can get labs for, 2 cents or 5 cents on the dollar because he passes through the ridiculous saving that you can go if you go directly to the labs to his patients. He passes on reductions in supplements and drugs. He's all about creating trust with his patients by helping them navigate what is clearly a super opaque system that's really not designed for you to just be sort of a lemming inside of. And, you really do need to be empowered to be healthy, first and foremost, and to navigate the system.
So, James, it sounds great in practice, but if we go back to your example with the arm, what if I do go in and they give me, say I want to pay cash and they give me $100,000 bill?
Yeah, so ultimately we have a billing concierge at New Health who is there to help negotiate that rate. But the answer to your question is, let's just say you couldn't negotiate down and it was 100,000, if it's a qualifying incident, of which breaking an arm certainly is, any sort of thing that happens to you, then you would pay the first 500 and it would be, 99,500 would be covered by the health share. That kind of thing is happening. People get cancer and the bill can be 100,000. But ultimately what the company that we've partnered with to create this first version of New Health is, they've been doing this for 30 years. They've been doing this on behalf of these other Christian ministries for 30 years. They get on average 60% off the bill, some cases a lot higher, because they know how to do this and they know how to navigate the system. So you always have that person available to you as your concierge for anything more than a doctor's visit. You can call them up and they'll tell you, okay, I need an MRI. Okay, there's 5 MRI places within 2 miles of your house, and this one costs $500 and this one costs $2,500, but it's the same machine. You should go to this one. So, just helping people navigate, because you wouldn't know. You live in Manhattan, right? So there's a million medical facilities. You don't know what anything costs. You don't know who has transparent pricing for cash. We do.
And so does New Health cover all sorts of different doctors? Like, for example, where do you draw the line? I mean, could I go and see a Reiki physician?
So a Reiki physician is not really a phrase that I've heard of before. There's Reiki practitioners, but I know what you're saying. So the truth, I just want to be really clear on something, right? Coverage means that a company, if you get coverage, that's an insurance word. And what it means is that a company has agreed to pay for certain things, right? Coverage is not necessarily your friend, because if you're a runner and into fitness and health, like people who are listening, the chances of you getting a chronic illness are so much lower than the rest of the population. But yet you're buying health insurance, but let's just be clear about what insurance is, right? You know what car insurance is. We know what home insurance is. It's like protection in case of a fire or your car getting stolen or wrecked, right? It's protecting your downside risk in case of an emergency. Health insurance, on the other side, is actually a prepaid drug plan, because the reason why it's so expensive, you have to price all these things into it. So I just want to be clear about what coverage means. There's no coverage inside our service. It's a community that shares each other's costs. Now, it's not like you can go to any doctor you want at any time who does any modality and we're going to pay for it. We're saving you that much money over insurance for taking care of that downside risk, that it's opening up budget for you to do whatever you want. So let's say I love Reiki, right? If I just happen to be a person who loves Reiki, given my previous example, if I'm saving $1,100 a month over health insurance for my care, I can buy a lot of Reiki every month with that. So I'm paying the Reiki practitioner cash. Reiki is not something that is part of a qualifying incident. And so I can choose to do Reiki, or I can choose to do acupuncture, or I can choose whatever I feel that I want. But I just want to make sure that everyone who's listening is understanding is that this is not an integrative medicine buffet where you can have as much chiropractic, as much acupuncture, as much Reiki as you want, and we're just going to pay for it all. There is that kind of plan, if it did exist, could never be cheaper than health insurance, because you have to pay the providers. So, our solution is massively reduce the amount that people have to pay to get medical peace of mind, to know that significant bills would be covered if some significant incident happened, and open up wallet share for people to, use whatever service they do. Now, in the medium term, we're going to track so much more data than has ever been tracked before. And if I was to find out in 2 years that everyone who visited a Reiki person was like way healthier and is going to have like significant less healthcare costs over the next decade, then we may consider changing the plan. And no one, that research does not exist.
Okay, that makes sense. So based on that, James, is there a strict criteria as to how and if you can become a new health member?
Anyone can become a new health member. You have to be an American citizen. You have to be under the age of 65. We can't take people over 65 because there are a lot of complexity with Medicare as a payer. So anyone under 65 can be a member. There's no exclusion criteria on that end. But it's not for everyone. It's a fit for 8 out of 10 people, right? If you are taking a medication right now, like if you have an autoimmune disease and you're taking Humira, and it costs $5,000 a month, and you're only paying, $400 a month in insurance, that's probably not a good fit for health cost sharing. You're getting great value from your insurance plan. That's probably not a good fit. But if you're listening to this podcast and you're healthy and you're health conscious and you're making your way towards your health goals, you'd be a great fit for it. So under 65, you probably don't want to be on your parents' insurance. They're probably over 22. And that could be a great fit, especially if you're self-employed or if you work for a company that's under 50 employees, because, a lot of Americans get their health insurance from their employer. And there are certain restrictions about that. So our target market is independently employed health professionals and other people that are, self-employed, because typically they're getting the worst pricing in the insurance markets because they're not part of a community.
Yeah, that was my next question. So for those people that are lucky enough to work for a big corporation, and or I don't know if they're lucky or not actually, because they only go and see practitioners that their insurance covers. And so they're actually very restricted in my opinion. But for those people who have their insurance paid for by the company, would they benefit at all with this type of care or not?
Their company can't purchase it for them if the company has more than 50 employees. If you have less than 50, then they can. But over 50, you're subject to not the individual mandate, but the employer mandate. So this first version of our product is probably not a fit for them. But, in the second iteration of where we're going, we are going to have a product that is just the functional medicine doctor network and the health coaching and the things that we're doing and the cheap labs. But that'll probably come sometime in the middle of 2019.
Okay, so if their employer does pay for their healthcare, could they get an additional healthcare through New Health if they were interested in that type of sort of functional
Possibly,
medicine?
but I would just say that this product, the version 1, like where we're going, there'll be all kinds of options. But today, this service is not. You can definitely sign up. I'm not going to stop you from signing up. But this product, New Health V1, is a medical cost sharing program that helps you to reduce the cost that you spend on taking care of your insurance. What we found so far is that people who have a job where they have insurance, they'll say, "Oh, I like this idea," and then we ask, "How much do you pay for insurance?" And they say $250 a month. And then what we see is that actually their insurance is $1,000 a month. It's just their employer is paying $750. And so they think it's $250, but it's actually $1,000. So I would say you're welcome to come and be part of it. But my recommendation would be that if what you're looking for is functional medicine, then I would go and see a functional medicine doctor directly, or just wait until later in the year when we have our service that's more designed for that. Because ultimately the first product that we've created, New Health today, is a medical cost sharing program that's designed for people who don't have another way of taking care of significant expenses like a accident or injury or illness. And typically, if you work for a company, you have all of that included.
It sounds excellent. In fact, I think it would go very well in a place like Australia where employers don't actually cover any insurance. So there's a general Medicare insurance for any citizen, but that's very limited, obviously. So, for example, if you go to a doctor, it'll cost, say, $60, $70, but you can bulk bill and potentially you might have to pay $10 out of pocket. But where things are heading in Australia is a lot of people take out private health insurance, which I guess is similar to what the insurance is here for employees. And so a lot of people decide not to take private health insurance because of the cost. And so this is where I think New Health would be absolutely very, very popular.
Yeah, we're gonna be, in the medium term, we will be a solution for almost everyone, and we see that in different countries around the world, we will play a slightly different role. If we go to the UK, in the UK you have the NHS. And, we can see that we could provide a service where maybe the NHS was the payer, where we'd be able to take care of chronic illnesses at a much lower cost than is currently being done. The medical cost sharing idea is probably not so useful in England because you have a government payer for everything. The reason why we're doing this medical cost sharing here in America right now is because as long as functional medicine, health coaching, and these kind of ideas are always things that are happening outside of insurance, the percentage of people that will ever engage with them is way too low. Because if you're paying X amount of dollars per insurance and that number keeps going up, you don't have enough wallet share to invest in the healthy things that you like. And so that's that, that you value. So ultimately, we see this exact moment in history where the tax penalty goes away and you can take care of your medical costs in as innovative way as you want, that this is an opportunity for a more participatory medical system, a more, preventive, predictive medical system to, community focused, to have an opportunity to grow, right, in a way that it couldn't really grow in another country because in the same way. So this is our opportunity here. There, I can see. I've been to Australia. I've had an opportunity to speak to doctors there. I understand a little bit of how the system works. Every country is going to struggle or is already struggling under the weight of lifestyle-driven chronic disease. So this will be a solution in all different places. But we are a small startup. We are not a government entity and we're not Amazon. So we just have to start in one place and then go from there. And that's where we're starting, is here in the States with New Health as a medical cost sharing program.
That's awesome, James. And do you think the insurance companies are going to start changing the way they do things? Or do you think this cost sharing will be, I guess, something that ends up being more of a private organization?
I don't know if it's going to change the behavior of the insurance companies. I mean, the word insurance is not really a good way of describing what companies who have traditionally done insurance in America do, right? 60% of the revenue of the big five insurance companies come from the federal government, right, as subsidies towards the care that they provide. The share prices of those five big insurance companies have gone up 10 times in the last 10 years because of the Affordable Care Act. Insurance is a very clear concept all the way around the world. Insurance was invented, which is you spend a little bit of a premium to be able to insure against some future event that may or may not happen. If you're dealing with people who already have diseases, you can't get insurance to a fire that's already started, right? So insurance is not really what's happening. What's happened in the last few years in America is that the government chose to deliver its healthcare through insurance companies. And I don't think that was a particularly good idea because of all of the things that I've already explained on the podcast about the pricing and the scamming and who's getting all the money and that kind of thing. Like, the government has put money behind an unbelievably inefficient system, which means that all those inefficiencies, which is essentially all these companies getting paid that have no discernible impact on health, they've just really grown that ecosystem, and that ecosystem is extremely unhealthy, is not contributing to health in any meaningful way. So, we believe that the only way to have a sustainable solution to chronic disease is to empower people to participate in their care. And that's why we build on a model that's built on empowerment rather than disease and risk and fear.
I love it. And I love that you took the approach of getting the doctors on board. You wrote the book, The Evolution of Medicine, which I know Mark Hyman regards very highly and said this book might just change the world. And so I guess you approached the doctors and you wanted to get the doctors on board. How did you go about that? And I guess where are you at with that, and what was their reception?
Yeah, so, we realized, like, in the big grander scheme of things, we couldn't do anything significant with the doctor network that we already had, that already existed, right? There's not enough functional medicine doctors. And yet there was, so the first goal that we had was to increase the number of functional medicine doctors so that we could build where this thing is going. So, so that was, we started a show called The Functional Forum. We've done 59 episodes over 5 years. every month. We got meetup groups all over the world watching it. The goal was to make it easier for doctors to learn about these approaches. When we showed up, most of this education that doctors can get in doing functional medicine, you have to take the weekend off, fly to a hotel somewhere and take this course, or even take a week off work. It just wasn't easy for doctors to make this transition. So that's why we created the Functional Forum, to make it easy for any doctor to find out about functional medicine and start to practice in this way.
And how many functional medicine doctors have you got on board with this program?
I mean, there are, it's not really a program. It's a show. So, we have that, but there are somewhere in the range of 30,000 in the country right now, depending on how you add it up. But 30,000 doctors out there that are practicing in a sort of a root cause approach that really focuses on prevention and focuses on empowering people to participate and looks, to get to the root cause of the illness. So there's about 30,000. I feel like we need still a lot more. And so, we're building the payer solution on one hand with New Health. We're still building the doctor network. And, as I said, by the time this presidency is over, we'll have connected those two things, and we'll have hopefully showcased the fact that, preventive approaches, using health coaching, using the power of groups and community can really create a health system that is much more effective. And then, down the road, we want to make it a lot more transparent. There's new technology arriving to make it a lot more scalable and transparent, so that people can feel really good about being in these kind of health cost sharing communities. A lot of people talk about Medicare for all as the solution in American medicine, and I would say it's a bad idea. And the reason is, even with Medicare only for old people, we're not, the government is not, is not capable of negotiating drug prices with the drug companies. So we can't just scale up that system. We need to find a way to reduce the cost of all the services. And that's why we're building on the cash economy, because medical cost sharing builds on that exact structure.
It makes total sense. Look, James, thank you so much for sharing the new healthcare system that's hopefully going to take over the world. I guess just before I let you go, I just wanted to ask you, is there anything that you could share with our audience, a tip or some advice or anything at all around their healthcare?
Yeah, the number one thing that I recommend to people is about community. It's about accountability and support. So, if you're a runner, then that running with a partner or running with a group is more effective, because you are kept accountable to it. Any behavior that's healthy is even more healthy when done in a community. And one of the biggest things that has to shift, if you get a chronic illness and now you have to make some behavior changes, we've seen that that's so much easier and so much more sustainable in a community. So my biggest recommendation is to use online resources to create offline connections and meet people locally who are interested in the same kind of things as you. And I wanted to that's my biggest recommendation for any practitioner or anyone who is looking to reduce their healthcare costs. I mean, ultimately, how do you reduce your healthcare costs? You don't get a chronic illness. I mean, that's the long and the short of it. That is lifestyle driven, one that is preventable. And so being part of a community is the most important thing for that.
That's excellent. And James, a question that we ask all our guests on the show, slightly random, but do you have a tattoo?
Actually, I don't. I don't have any tattoos. My wife has 5. I have none.
And are you sort of planning on meeting her at, 4 or have you got any desire to get a tattoo?
Maybe to do with my kid, maybe, but I don't know. I don't think so. I haven't felt a desire to do it, and I've probably had a few opportunities to do it, but no, not at this moment.
Excellent. Look, thanks again for coming on, and for all our listeners, I'm going to put everything in the show notes. Obviously, a link to your website, podcast. And
Thank you very much. Yeah, great being with you and your community. If you have other questions, if you go to New Health, we've got a whole FAQ section. We've got people on staff ready to answer any questions you have about it. We would love to welcome some of your listeners as members, and look forward to doing that.
And thanks again for changing the world, James.
We'll see, step by step. Thank you very much for the opportunity to connect with your community.
For all the resources and show notes from today's episode, please go to www.ali.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.